Hi guys, so in this short video I'm going to try and talk about oxygen therapy, something of great significance today, primarily due to the COVID situation. So unlike most of my other videos, this video is not going to be particularly beneficial from an entrance exam point of view or from any exam point of view. It's going to be more of a practical discussion, and I'm going to stick very much to the basics because even I'm no expert on this topic. So basically this video is aimed or directed at those interns who are starting up their internship now and who are going to be posted in the COVID wards. So it's just going to be very brief and very basic. So before I delve into it, conventionally O2 delivery or O2 therapy can be of two broad types. One is a high flow oxygen therapy and the other one is your low flow oxygen delivery or low flow oxygen therapy, or high flow oxygen devices and low flow oxygen devices. These are ways in which you can deliver oxygen to the patient. So the high flow devices include a Venturi mask, a high flow nasal cannula, or your non-invasive ventilation. So most of these high flow devices are limited to the ICU settings, and this discussion is really not going to delve into any of that. Today I'll be talking more about the low flow oxygen devices which are frequently used in the wards, right? The low flow oxygen devices which are used in the wards and which you will be mostly using at your ward level. Obviously, if the patient is not controlled by these measures, you will be shifting them to the ICU. So the low flow oxygen devices, the popularly and the commonly used ones include the nasal cannula, the face mask, and the NRBM or non-rebreathing mask. So it's important to remember the three of these because you'll be using these frequently: the nasal cannula, the face mask, and the NRBM or the non-rebreathing mask. So a little bit about these and when you should use them. Firstly, nasal cannula. This is the simplest and the smallest and the most popular, most commonly used oxygen delivery system. So as you can see, there's a tubing which is connected to the O2 outlet, and here you have two prongs which go into the nose of the patient. So nasal cannula, like I said, it can only deliver a very small amount of oxygen, and it's usually used to deliver anywhere between 1 to 6 liters of oxygen per minute, usually 2 to 4 liters of oxygen per minute, but you can remember the range for nasal cannula being 1 to 6 liters per minute, and it should only be used when the SpO2, the saturation of the patient, is anywhere in the range of 90 to 94. If it goes below 90, you're not really going to benefit by using a nasal cannula. Coming to the second one, which is the face mask. Again, you can see here there's a tubing attached to a mask which goes around the face like this. So face mask can be used to deliver anywhere between 5 to 10 liters of oxygen, and it's really important to remember that when you're using a face mask, you should never give a flow rate less than 4 liters per minute. Please ensure this. A lot of times you see patients, you're tapering them down, bringing down their oxygen requirement, so you go from 4 to 2 liters, but you forget to change from a face mask to a nasal cannula. So please ensure that you do change, because when the flow rate is lower than 4 liters per minute, you start having rebreathing of carbon dioxide. So face mask should never be used when the flow rate is less than 4 liters per minute, because you start causing rebreathing, which can again lead to hypercapnia and whatnot. So 5 to 10 liters is the range for the face mask. Coming to the NRBM mask or the non-rebreathing mask, again you can see there's the mask very similar to the face mask, and to that you attach this large reservoir bag which has a capacity of around 1 liter. So this reservoir bag is attached to this mask, and remember that there's a valve between these two which prevents rebreathing. So again, the NRBM mask is used for the range between 10 to 15 liters, and it should always be worn tightly and fixed tightly to the face. So remember, NRBM is super effective. It can actually provide an FiO2 of 95% when you're giving 15 liters, which is a high amount. FiO2 is the amount of or the fraction of inhaled oxygen, and 95% is a very high amount which can actually be delivered with an FiO2 with the NRBM mask when you give 15 liters per minute. And NRBM with proning is the best option available when a ventilator or an NIV or HFNO is not available in your hospital. So NRBM with proning is super effective. So NRBM, again, 10 to 15 liters. So to recap, 1 to 6 liters you can give up to, or you can give using a nasal cannula. 5 to 10 liters you can use a face mask, and if you're going above 10 liters, that is 10 to 15 liters, you can deliver it using a NRBM or a non-rebreathing mask. That's a mask with a reservoir bag. Remember, always when you're using the face mask, never go below 4 liters per minute. So it's just a short video, more of a practical discussion. Like I said, the other devices like the Venturi mask, HFNO, and the non-invasive ventilation are more for an ICU setting, and maybe we can discuss that in another video. So this was just the basics for the interns going into the wards right now. Hope you guys do well in the wards, and hope you guys apply some of these principles. Before I go, lastly, I just want to mention regarding the FiO2, because this could be important from an exam standpoint. The largest or the biggest FiO2 you can deliver using a nasal cannula is 60%, sorry, 40%. With a face mask is 60%, and with a NRBM, obviously I told you this, you can deliver up to 95%. Okay, 95% is the amount of inhaled oxygen you can provide, or a fraction of inhaled oxygen on FiO2 you can provide using an NRBM. So yeah, that's it for this discussion. Try to limit it under 5 minutes. Thank you.